Welcome back to the Common Ground Stories podcast. Today, I'll be having a conversation with a great friend of mine named Victor Pereira Sanchez, who has an MD and PhD, and we'll be talking about his career journey in psychiatry and his expertise in the mental health field. Amigo Victor!
How are you?
I am well. Great to see you.
Great to see you too.
Yes, sir. Been a while. Long time no see.
Yes.
So thanks for joining me this evening. Of course, you joined me. We want to hear a little bit about your story. So where did it all start for you? I know you're from the great country of Spain. Is that right?
Yes, I'm indeed from Spain. Actually from the northwest of Spain, a region called Galicia.
Mm-hmm.
I spent all of my infancy, childhood, adolescence there. Then I moved to Pamplona and then to New York. I've been in New York for 5 years.
Yeah, fascinating. I must have met you right when you moved to New York, right?
Yeah, I think you were one of the first people I met.
Oh, I didn't even know that at the time. Yeah, we met through Opus Dei, great organization. How did you end up in New York? What led you there?
So I was always interested in during the last years of my medical school and during my residence in psychiatry in Spain at the University of Navarre. I became very interested in child and adolescent psychiatry. I can say that, for much of my life, I've been oriented to medicine, helping people in need. And I was very drawn to pediatric medicine, helping children, but I didn't know anything about mental health and psychiatry for most of my life. I knew a bit that there were people that were so quote unquote crazy or with problems, but I didn't know that mental health is actually a medical and psychological issue, right? And that mental health conditions affect many people. And everyone is like normal, but can be affected by mental illness as they can be affected by cancer or any other stuff. And during medical school also, I learned that children are actually affected by mental health issues, and more there's a growing problem, and there were very few solutions in very little research. So I became drawn to serve the children through a specific area of medicine that it was psychiatry. And at that time, as it still happens with many parts of the world, child and adolescent psychiatry is a neglected area of medicine and psychology in general. Psychiatry is very neglected in general, but especially child and adolescent psychiatry is very neglected. At that time in Spain, there was no official training in child psychiatry. So if you were a doctor, you wanted to learn about child psychiatry and serve patients as a child psychiatrist, there were no official routes to become certified, to learn what you needed to learn and to practice. Although there were doctors that were practicing there, many of them were trained overseas, or they were trained on their own in Spain, but with no official certification. So at that time, I learned that I would have to go overseas to train. And unfortunately, I found a foundation in Spain that's still running, Fundación Alicia Koplovitz. So it's presided by a lady in Spain that dedicates a lot of effort and money to promote the mental health of children in Spain. And I got a scholarship from them to come to the United States and train.
That is amazing. So you were at the University of Navarre, got this great scholarship, and you've been here ever since, helping children and studying and learning about their needs, right?
Mm-hmm.
And you work for a local, I guess, hospital or?
So since I came to the United States, I've been actually more in academic positions. I haven't been so far doing direct clinical work because of cross-country or across country license requirements. I'm fully licensed in Spain. I'm certified, but not yet in the United States. But I have been taking advantage of this time to learn a lot in terms of formation in the field at NYU, Columbia University, mostly these two places. I spent also 1 year in a nonprofit, and I spent much of this time doing a lot of research, teaching in the area, and some international nonprofit work. So developing some learning skills in non-clinical areas, but are also very important because they are geared towards public health. It's not so the clinical aspect, and it's something that at some point I'll want to recover as well. But the clinical aspect is very important, like helping each individual, each patient that comes. But also, it's very important to have a public health lens, trying to find what is going on at a global scale, what is going on at a public scale, and try to advocate for instance, for more funding, trying to do more research to understand what are the problems, what are the areas of focus, and also trying to find and implement solutions that can help more children rather than one children at a single time in the clinical office. That is important, but also it's very important to have solutions that can help more people at a larger scale.
Absolutely. So, this is, obviously important, right? Mental health, public health, especially since the pandemic, we've realized how vital mental health is. And, you probably came just before the pandemic, and you've probably seen all the crazy things that have happened just in society with mental health issues, especially in New York. And, this is great work that you're doing here. And, this is fantastic. But I have a question for you regarding the mental health crisis and your role in it. When did you get started with helping people with mental health issues?
Personally, when did I start helping people?
Yeah.
Here in the United States or in general?
Just in general.
Yeah, well, as I said, I did not, like many people, I think this is changing, thankfully, but like many people that grew up in the 90s, early 2000s, and even before, but I grew up in the 90s, 2000s, I think we were still a generation in which we didn't hear much about mental health. In our schools, now it's different, but in our schools we didn't hear about mental health. And we have colleagues, classmates that struggle with issues. I have some colleagues that actually struggle with issues. Now it's easier to get medication if needed, for instance, for attention deficit hyperactivity disorder. But I have some colleagues that now, looking in retrospective, they have this problem, but they were not diagnosed and treated until they were in their 20s. And they struggle a lot at school. They struggle a lot in college or in university, and they found out late. So I didn't know about mental health. As I say, that what I know that there were sometimes some people in the streets with problems, people in mental health centers, but I was not familiarized at all. Actually, also is Spain. The mental health system is very different. Like the welfare system is very different, and also the cities where I used to live were smaller. So you don't see what you can see in New York. In New York, even if you are not a mental health professional, you can see that there are issues, right?
Yeah, a lot of issues. Yeah.
You need to go to the street, to the train. You see it every day, right? But it was not my case. I was not familiarized at all. When I was in medical school, I started studying in the first years about antidepressants, depression, and I was like, what the heck is this? I knew about depression, but I thought depression was just people getting sad because, I don't know, I heard people that got depressed in my school or whatever because like a relative died, So I knew about that, but I didn't know like depression is actually also a medical issue. There are in some cases there's chemistry in the brain that is and neurocircuits in the brain that have a role, and medications in some cases can help. So I started learning about that. It was, and then I did during medical school. I did some clerkships in psychiatry. One was actually in Ireland. Actually, my first one was in Ireland, and it was my first time actually full time like dealing with people with severe mental disease. Was a hospital in Galway. We're treating, and it was my first time actually being one-on-one by myself. And I realized this is a lot of suffering, and it's a suffering that is different because it's just inside of you. It's not like I cannot see the wound, I cannot see like a tumor growing, I cannot see anything in the images. Even if I look at the brain with an MRI, I cannot see anything. But like people here are really really suffering. There was a lady that has lost, I think, a daughter. And she was really suicidal, and she was like, I want to go meet my daughter. I don't have anything else to do here in this life. There was so much pain, and I realized this is legit, and I want to work in this field to try to alleviate this suffering.
That's amazing. I mean, I think everybody at some point, goes through some type of suffering, right? And a lot of people suffer silently in their depression and mental illness. But you mentioned treating it with prescriptions. Do you think that's the only way to treat it, or is there like more holistic ways to treat it without having to receive medication or other types of physical things?
No. Of course, it's not the only way, and sometimes it's not even required or needed. Like this way of treating people with a holistic model in a way that we can say, or we also say like through a biopsychosocial lens, right? That's a model in medicine that is old. I mean, it's relatively old. It's been as such presented, like I don't remember when it was introduced. I think it was Dr. Engel in the 80s or 90s. But actually, it's a model that we always strive to live, and it's not only in psychiatry; it's in all of medicine, right? So, for instance, there are many conditions like very prevalent conditions, heart conditions, right? Sometimes you need a medicine, but also usually, or diabetes, you should start like with diet, eating well, sleeping well, doing exercise, right? And then in some cases, medicine. So in psychiatry, it's the same.
I have to ask you something too. You mentioned the chemical imbalance. I believe that's a big factor for a lot of people. Not everybody, but some people, unfortunately, have a chemical imbalance that causes depression and other types of mental illness. And do you see that a lot? How do you know when it's a chemical imbalance versus something else causing their depression or mental illness?
Yeah, I'm not gonna use directly like the chemical imbalance. I mean, it's been traditionally used. Now there's a lot of controversy, actually, especially in depression. There were a group of researchers in the UK that did some studies, and their studies suggest found that the hypothesis of the chemical imbalance is very weak, and what is true is for psychiatric disorders, and this distinguishes us from neurological disorders in general.
Right.
More complex than that. But psychiatric disorders, we haven't found anything very solid biologically to say like, oh, we know that this person has this imbalance and we can measure it. With the evidence we have so far, we can say that many psychiatric disorders, especially the most severe ones like severe depression, schizophrenia, bipolar disorders, there's something going on in the brain. We don't know exactly what in all cases, or in detail at all. But we can tell there's something going on. So again, like it's a mix of factors. Some psychiatric disorders, like bipolar disorder, for instance, or ADHD, they have a very strong genetic component. But it's a genetic component that is different from some classical genetic diseases, in which, like, if you get the gene, you're screwed, right? If you get the gene, you're gonna get this disease. You must get like fibrosis cystica, cystic fibrosis, or some other diseases, like some people that die very young with problems in the heart. Like they have these genes, right? In psychiatry, there are some diseases that have a strong genetic component, but it's not just a gene. It's like thousands of genes, many different locations, and even having all those genes don't make you have the disorder, but make you very, very vulnerable.
Right.
So it's genes, but also usually there's gene like nature, but also nurture, right? Like if the person has been suffering trauma, right, or neglect during childhood, so those things can activate the genes, so to speak, and can make those genes express and cause the harm. For instance, for psychosis, like there's also like a lot of genetic component. But then maybe it's in teenagers, like if they get exposed to cannabis, then there's a very bad combination. If you have these genes and you add cannabis, that is what triggers psychosis in many cases, right? So yeah, there are definitely biological components in that we can say in many diseases. And they have a role, and we can see it in the way, again, we cannot measure it, at least so far, with lab tests, with imaging, but we can see in the way that people respond to. There are people with some disorder or some forms of depression. They don't respond to medications, but sometimes they respond to, in severe cases, to electroconvulsive therapy, right? So you can see like there's definitely a biological component, right? But in other cases, no, they don't respond to medications. They actually respond to psychotherapy. So you'll see there are components that are not as strongly biological, are more like related to personality sometimes, to temperament, or to ways, patterns of thoughts, patterns of behaviors that can be changed with therapy.
Right. Now, is there any specific, within this broad field, is there anything in specific that you're focusing on at the moment or have been focusing on?
So in my first years of training, actually, I focus a lot on attention deficit hyperactivity disorder, ADHD,
right.
Which is one of the most prevalent issues, especially in children. So I focus a lot on that. I did my PhD on that, and I actually did a study in which I did brain imaging, MRI imaging, magnetic resonance imaging with children, to try to find what could be the effects of medications. And I mean, it was a small study. I found some indications that the medications were probably helping like reorganize the circuits, because it's not only chemistry, it's also circuitry, right? And the way the
way the brain is wired, right?
Wired, exactly. And medications seem to help with that, like rewiring the brain. And so yeah, I was focusing on ADHD. The one of theory of ADHD is that, I mean, there's a problem with the development of the brain, and one of the things that this causes is like the circuitry is messed up, right? There are too many connections. There's too much noise. For people who know a little bit about electricity, you know that you need the right amount of connections. You cannot have like cables, and you cannot connect everything with everything. You cause a shortcut.
Yeah. Over circuit,
so
overthinking, it's overdoing it, right?
Exactly.
Yeah.
So it seemed that medications, one of the mechanisms of medications could be actually rewiring, like reducing noise, right, and increasing signal to noise ratio in the brain, to focus on the services you need. So, for instance, if you need in this moment to take a test, right? You don't need your circuitry related to imagination and fantasy active, right? You need to deactivate that. You need to focus. And then that was earlier on, like also like from my last years in Spain and my first years in the United States. But then, especially through the pandemic and seeing the global need for action, for understanding as well of the needs of people in this country, in this city, but also globally, is when I shift my focus to an area that I'm now working on, that is global mental health. So global mental health means trying to focus on the mental health of global, means everyone, but also everywhere. Right. So we are focusing especially in people that are disadvantaged, don't have access or quality care. There's a gap, right, for these people. So we focus on people that are both here locally. So for instance, now my specific focus is here, New York City, people in disadvantaged neighborhoods, Upper Manhattan, Washington Heights, South Bronx, especially Hispanic populations that have had less access or quality of mental health. So that is one side of global mental health that I'm focusing on. But also there's another side that global is international. So countries with less resources. So I've been working in collaboration projects in Mozambique. I've been collaborating with people in Peru and many other countries in the world. But
yeah, I've seen your travels. It's I've seen you've been in quite a few places recently.
Yeah. In Mozambique and Brazil, the last few months, Peru.
Thankfully, I've never been, seriously depressed or have any major, mental illness. But I do know people that have. But for me, like, if I ever get like down on myself, one thing that helps me a lot is the social aspect, being around others and getting fresh air, maybe going for a walk or doing something out of the house. Like in the pandemic, I think it was so destructive being inside, basically every day, all day, and not having that social interaction and just some fresh air. Have you, I don't know if you've ever seen any studies about that or what you can comment about just that kind of therapy?
That is totally right. Actually, like social connectedness and actually everything that is related to healthy lifestyle, it helps everything. It helps cardiovascular health. It helps like brain health. Tends to reduce the risk of depression as well. So definitely, and social connection, especially for mental health, is essential. And yeah, there's mounting evidence about that. I didn't look at it in detail, but today I saw there was a new study. I think they were just doing like massive statistical analysis of data, and they were finding that apparently, like in a very big population, people that were more socially connected and had diverse social networks. So not just, a group of friends. Diverse social connections. I don't know the study in detail, but in real life it could mean, like, for instance, I know you, that you are now in Florida. But you are in a circle. Maybe now people that I met through Opus Dei church events, but also I have a circle in my local parish. I have another circle in other parishes or in other groups of people with Opus Dei here in New York City. So they found that people with diverse and cohesive social networks, they were people that usually need less or were less likely to be taking medication for depression, right? So it's not the only solution, or sometimes there are people that they may be well connected and still need medication, but it's actually very powerful.
Oh yeah, and you mentioned the Upper Manhattan, South Bronx areas. I lived in Harlem. I lived in Inwood, and it's interesting to see how even like the city, I guess, how they put like different resources in different areas more than others. And so how basically, you're right, people that live in those areas, doesn't really matter if you're Hispanic or whatever the case may be, if you have less access to resources, especially for mental health resources, other resources up there than you do in like the nicer neighborhoods, like, well, like let's say the the Upper West Side, Upper East Side, where there's tons of resources available. So I can imagine that's a challenge, because some people never leave those neighborhoods. They basically just stay there most of their lives in some cases.
Yeah, in global mental health, I mean, there's a saying that in terms of mental health, every country in the world, including the United States, is a third world country, right? Or is a developing country, and it's true. We have other areas of medicine in which you can see more of the difference. Like you see in wealthy countries, you'll see that is most people can have access to services for what they need, for cancer, for whatever. There are gaps, but in mental health, almost every country has an unmet need, and this is the case of United States, where the United States has a lot of very positive aspects, a lot of research, more research and development than any other country in the world, I would say. But in terms of mental health, like the disparities are well noted.
Well, I think too, to add to your point, mental health does not discriminate against anybody or any country. It affects rich people. It affects poor people more because they have probably less access to resources. But mental health is a problem that every person from every walk of life can face, and especially now that you mentioned, 10 years ago, 20 years ago, it wasn't mentioned as much. It wasn't a priority as much as it is now, especially since the pandemic. And yeah.
They are like all of health, but especially mental health is very much affected by what we call the social determinants of mental health. So again, it doesn't discriminate, but as you rightly said, there are people that have, because of the social conditions, they are more likely to be exposed to risk factors that contribute. It's not the same, say, to grow up in an affluent area where you have a nice school, you have parents that are home. When you come back home, or they will be home, it's not the same as living with a single parent, because the other parent is maybe in prison, or is missing, or has died by suicide, by drug overdose, and maybe you are living in a neighborhood where like you cannot go to the park is risky. It still happens, right? In some areas.
It's a very real thing.
You hear every month about someone your family knows that was killed in an accident, was killed by gunfire or overdose. Like there are many kids, sadly, that grow up in these conditions, right? And these kids are usually more concentrated in certain areas.
Do you think that there's in your opinion, do you think that there is some type of solution that we may find, or that we're like uncovering to like really end the mental health issue, or is it something that you think that could help at least mitigate it in a lot of cases?
Yeah, I guess mitigate it. And problems probably will exist as long as humanity exists, and people have a mind, have a soul, have a brain. But of course, I think we can do a lot to mitigate suffering. And one is, we were talking about social determinants. I mean, helping with improving social conditions can go a long way, right? Sometimes people don't know, or you don't know what's before, like the chicken or the egg. Like for instance, a person that is unhoused, right, or homeless, as they will say. Many of them like have serious mental conditions, and sometimes you don't know what comes first. Like maybe this person, in some cases, like they are veteran, and maybe like they after service they didn't have a job, but they had trauma, and then that made them to have or contributed to them having mental health, and then they lost their house, their apartment, but then they got into drugs, and that contributes to them not having a house. Sometimes, like, you don't know, right? What is before, what is after. But of course, like, all we can do to help improve the social conditions, especially since early on, since childhood, all that can help educate more families, and not only educate but support in parenting, in positive mental health parenting, and then of course services. It's going to be difficult, like, to just pour out, because there's not that much money. But even like if you pour out like a lot of money, it has to be strategically. Of course, we need more specialists, we need more psychiatrists, clinical psychologists, nurses, social workers, people that are specialized in mental health. But also we need to, and part of my work is trying to develop that, we need to work more with the communities to increase mental health awareness and mental health resources within and counseling within the communities. So we can have a system that is more step care based, right? In which people can go first, if they can go first to their community to find a solution, to find help. And if they are not able to get enough help there because the issue is maybe severe, then they can escalate first to primary care maybe, and then to specialized care. But the solution is not like trying to get people into hospitals, trying to get people into clinics, because it's not going to be enough. It's going to saturate the system. The system is pretty much saturated now. We need solutions within the communities.
I 100% agree. I think that the most effective way, in my opinion, just from my experiences, especially like when you're a kid, a good family, having both parents present, having grandparents and then other family members, a lot of times helps mitigate or prevent a lot of these issues. And if they do have issues, they have a good, basically, family community to help them out, especially when you're a kid. And then as a young adult or older adult, it's important to have that community tie, the ties in the community, and the social aspect in the community as well, on top of the counselors and therapists like yourself to be present in those areas, especially in New York. There's so many people and there's so many tight-knit communities, like Washington Heights, a very tight-knit community. South Bronx, same thing. I know you mentioned that you're doing a lot of research. For you, like, what's the next step, or like what's the end goal for you, like down the road in your career?
Not sure, because things develop. But one thing I learned is need is everywhere, and that I should focus more on local work and helping my local community. Again, like, I love international work, and I want to keep it as much as possible. But I was, as I was saying, I was traveling a lot, doing a lot of stuff, but also I went to I started going to the parish, right? And then it's now my parish, and the priest say, "Hey, like, you're a psychiatrist. We need a lot of help here." And then I started learning a lot, and then I say, like, at some point I want to actually not only be in this community and being part of the ministry, a ministry in the community, but also I want to put my professional skills and actually dedicate as much as possible my professional job to help this community. And I'm doing it right now, right? So this is something that I would like to keep pursuing. Some point, like, be able to do some clinical work, like individual treatment, but also combine that with, as much as I can, research and public health action in the community.
Hey, that's awesome. That's really great stuff. Now I have a question for you too. It's my understanding that you have you're an MD and you got your PhD, right? And like, do you have to study more to be certified in America, or how does that work?
So, I mean, this is not just unique in America. Usually, like, for doctors, it's very difficult to practice in another country. It's almost impossible without completing training in that country. So here, I would need to go, except for medical school, but repeat the rest, like the medical license exams, residency, and fellowship training.
Okay, and so are you in the process of that, or is it just like down the road for you?
I'm in the process.
Good. Well, I hope that goes well for you. And it's great to have a friend like you that has dedicated your life to helping others, especially children that have, or that could be having mental health issues. It's very, very, very good work.
Every time, like we mention mental health, we mention issues, and I actually mention suicide several times because it's important. But one thing or one resource that I can say from now is that first, this is suicide is tragic, but it is common. Not just completed suicide, but thoughts of suicide, and acts of suicidal attempts. So this is something that can happen to anyone, but there's a lot of help available. And so if you struggle with this, if you know anyone who struggles with this, there are a lot of resources. Search in your own community. If you are like in a church community, in many cases they can help you with that. And also for emergencies, there's a phone number that is, since a few years ago, is dedicated to mental health crisis and suicidal crisis, 811. If I'm not wrong, it's instead of 911, 811. It's specifically dedicated, so don't hesitate to call if you need.
And my advice too is, my I guess to add on to that, my advice is to anybody listening, check up on your friends and family, see how they're doing. You never know what somebody could be going through. Maybe you haven't reached out to somebody in a while. See how they're doing. You never know what they could be going through, and it might just help them. It might just save a life.
Yeah. Be available, and there's people that are going through a mental health crisis or like a dark time. Sometimes they don't feel even strong enough to ask for help. Maybe they are ashamed to ask for help, or maybe they are just it doesn't come out. And sometimes it does not help, like to be very, very insistent or like asking like, what's going on with you? Do you have a problem? But do be available at least. In some cases, actually, you just suspect it. You can ask, and we know that asking about suicidal thoughts doesn't plant the idea in that person, right? But actually, if that person have that idea, they will, in many cases, they will tell you, and they will be happy that they can talk about that, right? But in any case, be available, because being available, being there, it gives you the opportunity and gives the other person the opportunity to speak up.
Absolutely. Well, Victor, we're running a little on time today, but very, very great and important conversation, and I appreciate your work that you're doing, and we'll talk about this more in future conversations and other topics as well. I know we want to get to, and I hope you have a great evening, my friend, and keep up the good work.
Thank you very much for having me. I think I appreciate also your work in having diverse conversations, and thank you very much. Have a Merry Christmas. See you.
Likewise. Adios.
Yes, thank you.
Welcome.